Good morning, everyone. Yay, thank you for joining us today. I'm going to do a presentation about Humana this morning. All of you have a different type of Humana plan, but we're going to cover the basics on how to get the most out of your Humana plan this morning. This will be recorded, so I will send this out to you and we'll have the slides to you as well. But at any point that you guys have questions or wondering if your plan is working the way it should work, we are here for you. You're welcome to reach out to us. As you can see on the screen, we've added a few more licensed agents to the office. So that means eventually I get to go on vacation. And there are other people there to answer questions for you. So feel free to reach out to us by phone or by email. You are welcome to email me directly, but if I am out of the office, the TIA is the easiest one to get a hold of someone more quickly. And that phone number rings to everybody in the office. So please remember to reach out to us. You don't have to sit on hold with Humana if you don't really want to. So let's go ahead and get started with the presentation. I'm just going to move this page ahead to the next page if it allows me. There we go. So today we're going to cover the kind of simple aspects of the Humana plans. And then at the end of the presentation, I will open it up where you guys can ask specific questions as well. We're going to confirm that you received all of your member materials and what those member materials really are. Whether you have a Humana spending account card, we'll talk about that, how to activate it, how to use it, what it can be used for. Not all plans have that spending account card. And then additionally, we'll talk about Humana's health and wellness member programs, caregiver resources, and then we'll open it up for the question and answer. Along with the recording of today, you will also have several PDFs that are attached to that. And those will be more information about Go365, the rewards program, Silver Sneakers, if you haven't set up your Silver Sneakers account and what you can do with it once it's set up. And then some additional information also about your particular embedded dental program. Dental tends to be the thing that gives us the most questions. People have lots and lots of questions, and our dentists have lots of questions about it. So we like to give you all the tools that you can possibly have to go to your dentist and feel like you have lots of good information that you can share with them about what you have embedded in that plan. All right. So hopefully everybody has received their member ID card. If you have not received a member ID card, either you can access it on your My Humana account, which we will talk a little bit about coming up. You can actually have an electronic copy right there in the app on your phone. And the other place that you can have this is by calling us. We can actually download a copy for you and send it off to you. You can also contact Humana if you have lost it and you need a new one. So those are all options for you. There's lots of ways. You don't have to wait 2 weeks to get your health insurance card back. Now we're going to talk a little bit about that Humana member ID card. And as you'll see here, we've got one that says Humana Gold Plus HMO. The other option that might show up on there is Humana Choice PPO. So the plans that they list here does not mean we know exactly what plan you have. There are 7 different Humana Choice plans out there, and there are 2 different Humana Gold Plus plans. Sometimes we'll ask you to verify what's on your card, and the number that we're going to be looking for is the CMS number down here. And likely you will see down here these last 3 digits. That's usually what we're looking for. And it might say 025 on yours, or it might say 333 for those last 3 digits. That will help us identify exactly which version of those plans you have. Then as we go through here, The card issue date, we always encourage people to go through their wallets. Get rid of your old health insurance IDs. Get rid of your old prescription drug plan IDs if you still have those. If something were to happen to you and they have your wallet at the hospital, they're going to be wondering which plan is really pertinent to you. Who has the emergency contact information on it? If they're calling another company to find out if you have emergency contact information on it and you haven't had that plan for 4 years, it's not going to do you much good. So clean out the wallet, get rid of all those things. Keep in mind that it is really important that your member name be correct on there. If it has an incorrect initial, if it's spelled wrong, that can cause problems in the claims process. So verify that your name is exactly how it should be. And then I like to talk about the member ID number. Once Humana issues a member ID number for you, you will have that same number no matter what type of plan or what Humana plan you are on. It travels with you. Even if you leave Humana to go to a different company later on, and you come back to Humana, say 2 or 3 years later, you're still going to have that same H number, so your Humana ID number. That is very unique to you. The plan ID, this is an internal number for Humana. So it's really not going to make sense to the providers or to us or to you guys. That is Humana information. The RX bin, PCN, and group numbers all pertain to your prescriptions. So when you go to pick up a prescription at the pharmacy window, or if you're trying to do mail order for something, they're likely going to ask you for those RX numbers right there. Then if you are to flip your card over, you're going to see your other phone numbers, including member care services, but also the numbers the places that you're visiting will need to call for claims, for pharmacy benefits, things like that. Then there's also a DEN number that identifies which dental plan is built into your particular version of the Humana plan. Then you also got an HER number, which is your hearing benefits. And then finally, there's a VIS for vision. So when you go to the eye doctor, that is the number they will use to access your eye benefits. Now, I've already mentioned the My Humana account. I'm hoping that maybe some of you have enrolled with it online, maybe on your computer. Maybe you have downloaded the My Humana app on your phone. It is really a handy service, and I think the biggest thing that it saves people with is that they can actually access their own particular plan. So if you go into the My Humana app or you are logged into your My Humana portal online, you're going to see doctors that are participating in your plan. If you go to the regular Humana website and you are trying to search for a doctor on your own, it's a little more difficult because they're showing all the Humana doctors. You have to know which network you're in, and that can be difficult to identify at times. So having a username and password for My Humana is really beneficial for you. It's also a place where you can see your actual member ID card. So if you do lose the physical copy, you can see it right from the app. You can also fax a copy from that app, even if you don't have fax capability on your phone. Humana will send it to your doctor's office. There's lots of different things that you can do with that Humana app. When we enroll people in Humana plans, we tend to put your primary care provider into that application. It's not a requirement for all applications, but we really like to have that on there and have you have a primary care provider home, that medical home. But if you were to ever need to find a new doctor, the Find a Doctor tool is outstanding You can see here there's a medical tab for your actual physicians. There's also a dentist tab, so you can see which dentists are participating. There's vision care and also pharmacy. So you can choose the distance here, you can choose your zip code, and then that eliminates the need to really, search beyond where you're trying to look. Some of us, we only want a 5-mile radius. Others, we may need a 60-mile radius to find all the providers that we will be using. Something to keep in mind is that in the vision care section, the vision benefits do have a little higher benefit if you have a plus provider. So this vision search will tell you which ones are plus providers on there. So pro tips, this is for you guys. What is the best way to use your plan? Well, first of all, you want to use your Humana ID card. That's going to process claims through your Humana plan. If you also have Medicaid coverage, you need to present both the Humana ID card and Medicaid. Medicaid being the one that has state assistance to reduce your costs. Not your Medicare card. Some doctors will want to see your Medicare card, but not all of them need to. The Humana ID card will suffice for that. Then other things that are important to know is, does your plan require that you see your primary care doctor before seeking care from a specialist? Our HMO plans do, so they would like you to see your primary care doctor before seeing a specialist. Most of us do that anyway. And PPO plans do not require that. I always give a little cautionary tale here. Most of the time, it's not the plan that's requiring the referral. It's actually the specialist who wants you to see someone else before you go see them. Perfect example, cardiac surgeons. Are they really going to just make an appointment with you if you have not already had some testing done, if you have not already seen your primary care provider and that type of thing? So it's kind of a no-brainer with that. Referrals can be a little bit of a pain, but honestly, it's something we do most of the time anyway. We don't often know a person that's going to be able to do a surgery or do treatment that we want to self-refer to. Googling doctors is maybe not the best way to find the best ones either. Yes, there are some ways to look up the doctors out there through Google. But the other thing about Humana's doctor provider search tool is that it has a care meter on there. And so it shows whether other Humana members have rated that doctor well. So do they care about you when you're in the office, or do they push you out as soon as they've taken care of what they need to? Do they take care of you efficiently with good cost savings rather than creating more tests that maybe won't help understand or identify any other resources for you? Another thing that's really important to do is checking your plan's drug list before filling prescriptions. Sometimes we don't have the ability to check before, but for example, when we shop for your plans with you, we check your med list. We want to make sure that your plan covers as many of your medications that it possibly can, that we're finding really good coverage for your medications. But if something comes up throughout the year and it's a new medication, you're unsure of how it's going to be covered. Or the doctor says something like, I want to prescribe this for you. And they just kind of throw it out there, let that linger for a little bit. You can check your drug list. That can be done on your My Humana portal. It can also be done by going into humana.com and looking at what's called the drug formulary. That is the fancy terminology for the list of drugs that is covered on your plan. And what you'll be able to see is whether that drug is covered, how it's covered, how much is it going to potentially cost you, and whether it has a notice on it that it requires a prior authorization. That would be your prescribing doctor saying, this is why you are taking that medication. They also have an RX calculator on the Humana site. So you can use the one that's just on humana.com, but if you use the one that's on My Humana, it will actually tell you the pricing of those medications according to how your plan covers them. So here's the last one. I keep saying it. The My Humana account does make it a lot easier for you to access these tools. Absolutely, you can go online to humana.com, but it takes a little more intelligence in there, a little more familiarity with how to do searches and things like that. So the My Humana account is super important. We talked a little bit about primary care providers and why I think you should have a medical home base. It's such an important thing as we get to where we may be managing multiple medications or managing multiple medical appointments with different specialists. Having that primary care provider there for you to do an overall medication review, to coordinate your care, to answer questions about, sometimes we go to a specialist and they're such a high level specialist, their answers may not make a whole lot of sense to us. And if you can run that by another physician that can help you really understand what they're saying, that can be really helpful. Also included there are your preventive screenings. Don't forget about preventive screenings. They are so important, and regular checkups. They can identify diseases that are sneaking up on us. That may be just a simple treatment to take care of it. But if we let it go too long, it can make you very sick. So all of those preventive visits, we want you to go to those. Humana wants you to go to those. There is no cost for you to go to those with your plan. In fact, Humana will pay you once you have gone to those. And that's the Go 365 program. We'll be talking about that in a moment. There it is, Go 365. So as you go to a doctor for your preventive wellness, if you have a mammogram, you have a PSA test, you have a colorectal screening, either a colonoscopy or a Cologuard test, you can earn rewards from Humana for taking care of yourself. The other rewards that are included for doing activities would be for volunteering. It would also be for going out for a walk, walking 5,000 steps in a month. Also for connecting with friends and family by the phone, taking an educational class. Those are all things that you can be rewarded for partaking in. Humana allows up to $160 per year for you to redeem those rewards. How you do that, that gets to be the tricky part. But what you can do is several things. You can sign up at go365.com and then you can log your entries in, all the things that you're doing. They believe you. So you're just attesting to the fact that you went for a walk, that you took a class. They're not requiring proof of it. You don't have to connect a Fitbit or any kind of device like that. And then once you have at least $10 in that account, you redeem them for gift cards of your choice. And you can do that anytime throughout the year. Reporting can also be done on the phone. If you're finding the website too difficult, you can call in and report, and you can report back up to 90 days. So you can save it all and report once a quarter and then take advantage of those rewards. For the medical coverages that are rewarded, for instance, your preventive wellness visits, that is going to be deposited into your account automatically. Once that claim is processed, it will then be put into your account. So they monitor the back end of that. Your Medicare,
Try again.
my watch is talking to me now. Medicare and You is also a wonderful book. If you're wondering if Medicare is supposed to cover something, That book has so much information in it. Additionally, there is an app for your phone called What's Covered. It is a Medicare app, and you can also type into that, is this a Medicare covered service? And those are really helpful things for you to understand what might be covered on your plan. And again, showing your Humana card wherever you go, and if you have Medicaid coverage, to show that as well. So schedule your annual wellness visit. COVID threw a giant kink into all of our wellness visits. I don't know about you, but it's been difficult to schedule with anybody since. It just takes forever. But during that annual wellness visit, you can get your preventive screenings, any blood work that you need done. You can get vaccinations, and there can be additional services there. If you have Go365, which each of you do, all of our Humana plans in Colorado do have that, you get a $25 gift card reward for going to that appointment. You can't beat that. So provider referrals, how do we actually address those? What is the referral process for your plan? They are varied by which plan you have, as we talked about. HMO, you should plan to get a referral. PPOs, you don't need to, but the specialist may require it. Your best option is to not think about it too much. Start with your primary care provider. That's the easiest place to do it. They are also a no-cost option for you. So you can go to that primary care provider anytime that you can get the appointment, and it's no cost. Bounce that question off of that person. They may be able to direct you to the appropriate specialist. They can give you a referral. I usually recommend that people get two names because sometimes you'll call that specialist and you won't be able to get in for months. Or maybe you're not fond of how you were treated by the office. So get two names while you're getting a referral. That's just really good practices. Then when we talk about Humana support, how do you get help with your Humana plan? Well, I keep saying this, but you are always welcome to call our office. We have run into lots of questions from clients, and Humana is one of our bigger companies out there. So we have lots of people, over 400 with Humana, actually over 500 with Humana plans. So you can imagine with how many questions you have that we may have run into those same questions from time to time. So you can give us a call, see if we have an answer. If we don't, we can probably find it for you. The other thing that we do is we will get on the phone with Humana support and you. So that way you have the right questions to ask when you get on the phone with them. Sometimes we're trying to figure out a problem and we don't know how to ask the right question to get to the answer. You just don't have the right words for it. Or conversely, you might be asking the right question, but the Humana customer service person may not be understanding the question. So we're there as kind of a translator for you. You can absolutely call Humana customer care on your own. They are open from 8 until 8, Monday through Saturday. So they do have much more hours than we do. And of course, they are available online as well. So you can request information online from Humana. You can see your policy information right there. It is important to try to use those tools that you do have, but remember, you can always reach out to us. Another thing that's really neat now is that we have gone back to some of our areas of actual in-home care. So yes, we can get appointments at the medical facility. And yes, we can do telehealth visits, especially for non-emergency. I really like that option. But there are also in-home visits. And some of the things that you may have run into is that Humana may have called you and said, hey, we would like to do a home visit with you. It doesn't have anything to do with how well you are or how sick you are. They're trying to introduce you to the fact that they make house calls now. And you can actually search for providers that do make house calls by going to that provider tool. There's a little button you can click that says home care, and they will come to your home. Not everybody is comfortable driving in the winter. Not everybody is comfortable driving when it's dark in December. And some people stop driving altogether. They used to have transportation benefits on most of these plans, but they've gotten away from it. And now it's just the Gold Plus that has the transportation benefit where you can get a ride to the doctor's office. So those transportation benefits are very rare now, but you can actually have a provider come into your home, and that can be really, really comforting. There's lots of reasons that that can be the case. If you are a caregiver taking care of someone else, it may be hard for you to get out and go to a doctor's appointment for yourself. So remember this option. Remember it's there. I sprained my ankle last October and was trying to drive around and be on crutches in the snow and ice. So I would have much rather had somebody come to my house to visit me. That would have been my preference. But instead, I was driving around and getting by. So our next topic is best practices for durable medical equipment. Everybody has DME or durable medical equipment coverage on their plan. It's equipment or supplies that are ordered by a healthcare provider for everyday or extended use. It is part of your Advantage plan, but you have to meet the criteria for medical necessity for your plan to cover it. If it's not medically necessary, but you want it still, there are other ways that you can do it. You can pay out of pocket. Sometimes you can use your over-the-counter benefit allowance to pay for that. And really, how it works, if it is considered medically necessary, then what you're going to do is have your physician write a prescription from it and some documentation if need be to support why it should be given to you, either by renting or buying that actual item. So examples, what can this be? Well, it can be as big as a hospital bed. It could be as small as a cane. These can include oxygen equipment, CPAPs, continuous glucose monitors, insulin pumps, things like that. So here it talks about the OTC allowance. If you're needing things like a blood pressure monitor, bathroom safety devices, those are all things that rather than going through that process of having the doctor write a prescription, getting it approved, sometimes you need it a little sooner than that. And some of those smaller things you can go ahead and use your OTC benefit for. So again, start with your provider. That person's going to write that prescription and talk about your medically or your medical necessity on that item. The provider actually submits the request for you. So you want to start with your provider because if you go out and buy a walker on your own, they're not going to reimburse you for it. The prescription has to happen first, and then the provider submits to have it covered. Once that request is received at Humana, a nurse reviews it. Sometimes they do have to have a doctor review it depending on what the item is. But the nurse reviews it and a decision is made. They will notify your provider about that decision. Because the provider is initiating the request for you, then they will notify the provider. They actually talk to the person that made the request. That provider then should reach out to you and notify you that it's been approved. You can have this done sooner than later. So you can put in an urgent request rather than letting it just take its normal time if there is a need for that. And the providers are very savvy about that. They've done this before. It's not their first rodeo for most of these things. So when they put in a request, if they know you need it immediately, then they can put a rush on it. So our spending account card, I'm not going to spend a huge amount of time on this one, but for some of the plans, like the Gold Plus plan, you will have a spending account card. The Humana Choice plans, the 333 plan does not have a spending account card. So you guys don't all have a spending account card, but this is what it looks like if you did receive this. Please know that you have to activate it to be able to use it because it is a Visa card, just like a debit card or a credit card. You have to activate it and basically claim it. Now, for our non-dual eligibles, if you don't have Medicaid, you are not going to have the Healthy Options food allowance, but you will have a flex allowance and you will have your over-the-counter allowance on there. The card is smart. So it knows that if you're at the dentist's office, you have $250 loaded onto that card that you can use for any excess charges that dentists may charge. It knows that if you are at Walmart, it's not going to dip out of the bucket for your dental, vision, or hearing flex allowance. It's only going to use your OTC benefit there. So OTC benefits are on each plan, but the people with the spending account card can shop in person. The people that do not have the spending account card must shop online or by phone or through mail order. Honestly, I don't recommend the mail order one. It takes forever to write it on there, to mail it, for them to process it. It's way easier to call in and then they can tell you what's in stock and what isn't. If something isn't in stock, then they can suggest an alternative to it if you're looking for something like that. Flex allowance. So a flex allowance on the spending account card can be used for dental, vision, and hearing items. It is only on certain plans. So again, the 333 plan does not have that flex allowance on it. To activate your card, you're going to go into multiple different ways, but you can go into the app. There's a QR code that comes on it. This healthybenefitsplus.com is how you monitor what's on your spending account card. There is an app for it as well, so it can tell you whether you have OTC left or if you have any dental, vision, and hearing left on your plan. And again, you can activate by calling the National Humana number if you need to. You can activate using this QR code. So if you're wondering, I can't remember if I activated my card. Right now, what you could do is you can grab your cell phone and you can point the camera right at that. And when you point the camera at it, it will ask you, do you want to go to this website? And once you go to that website, then it will prompt you to download the app and begin the activation process right from your phone. It makes it so easy. And again, just so you guys know, these slides will be sent out to you too. So you'll have this QR code once we send those out. So what is the best methodology of activating and using that spending account card? So if you have the spending account card, you can shop for your items at Walmart or King Soopers or Safeway. And we know that if we're at Safeway or King Soopers, then they always have a discount card. And so you're going to go do your shopping and you're going to put all your items through the checkout. But one of the things you want to do here, this pro tip right here, it says swipe your store loyalty card or coupons before you use your spending account card. And the reason for that is then it's going to take those items off after the discount has been applied. If you use your spending account card first, it's going to take more of that money out because that item wasn't on sale. So use your loyalty card first and then use your spending account card next. Don't forget about sales tax. You have to pay the sales tax with your card or another form of payment. So shop, check out, do your loyalty card, swipe your Humana card, and then pay whatever else is left over for the services. Some of the places where you can use that spending account card include Albertsons and Safeway here. Includes Kroger, King Soopers, City Market, CVS Pharmacy only. So that is not all of Target. We want to make sure that you recognize that. Walmart, Walgreens, and then we've also got Ace Hardware in here. So that was kind of one of those that I didn't understand right away. And then later on I did. So if you need to have bathroom safety equipment, Ace Hardware would be a place that you could get something like that. We don't have anybody on the call today that has bill pay service activation, so we'll just go over this real quickly. That local Walmart customer service desk or money center can help you with that. You can pay your services online with the Healthy Benefits Plus account or by phone. Pest control and transportation services. So this is for our DSNP clients. The flex allowance, just to give you another quick review of this, dental, vision, and hearing. Same thing, you would process the bill first through the insurance portion of the policy. Have that covered as much as possible, then swipe your spending account card and whatever is left that qualifies for it will come right off of that $250. And then the remaining balance will be yours to cover. Health and wellness programs. So Humana has a huge list of health and wellness programs. So we'll go over some of these because they're not all right there in front of our face. You can learn about all of these on My Humana. These are different things that you can do too, is confirm communication preferences. Is anybody tired of getting phone calls yet? Yeah. And then you can also get things online or by print. So if you decide at some point that, I'm not liking this online version, or I don't like getting all this mail, you can switch it on your My Humana account. Can learn about your prescription costs, find in-network doctors. Then there's also special discounts that will be added into your My Humana account. So sometimes it is I'm trying to think of, they've had 20% off of vitamins at a certain vitamin store. So they will add different discounts and value-added items. They'll come and go. They're like coupons out there for you. So there is a special section on My Humana for that. There are also different things like if you stay at a La Quinta, between such and such dates, you'll get a discount for that. There are lots of different things out there. And there's also all of the tools and programs for health and happiness, and that's where we're going to go to next. Not going to cover this, but this is embedded in the presentation. It's a YouTube video about the My Humana app, and I think it's really helpful. I do want you guys to realize that the computer version of My Humana is different than the phone version of My Humana. That is because the Division of Insurance does not allow all of the same things to be available on your phone as on the computer. I'm not exactly sure what the logic is behind that, but that is who controls it. So we don't have the same capabilities on the phone as on the computer. So downloading it, you're either going to go to Google Play or your Apple App Store, and you will look for the My Humana app and download it. And then also doing this on the computer is simple and easy. You go to Humana and click register. My account, select Start Activation, and they will ask you a few questions. You'll need your Humana ID card, and you'll be able to access My Humana Go 365 and the CenterWell Pharmacy all in that one website. Silver Sneakers. So Silver Sneakers is included with your plan, and that is something that most people know about. For those of you who don't, it is basically access to gyms and fitness classes at no cost. So you can get into any of the gyms that are Silver Sneakers affiliated throughout the country. Not just in your own neighborhood, but if you travel to go see family and you want to go for a swim, go work out, stay on your regular routine, Silver Sneakers is there for you. You can go to silversneakers.com, search locations by zip code, and you can use it as much as you want. There are also virtual and on-demand classes. So online or with your mobile app, you can take classes, you can do them on your own timeline, or you can actually schedule them to where you show up for Tai Chi or balance classes without having to, have it be on a timeline, or you can have a live class where you see everybody else in the class with you. This is a great video too that you guys are able to watch. This gal maintained swimming in her life after having diabetes and not having medical treatment originally and going blind. So it's a really heartfelt story. Humana really tries to connect people and keep them going, essentially. So keeping your body moving, however you can move your body to whatever disability you may have or not. It improves your brain health, the ability to do everyday activities. It also strengthens your bones. So that's a really important thing as we age, that keeping muscle tone keeps your bones strong. Can reduce disease, and of course it helps with weight management. Silver Sneakers virtual and on-demand classes, you'll see there's 3 different levels. And there's everything from fall prevention all the way up to Zumba and Tai Chi. So you've got lots of choices there. Take advantage of that. Lots of people pay money to have this kind of option. So it's right there for you. We talked about that Go 365 already. This number here, though, please remember that is incorrect. It's 160. So I was not able to correct that slide before we got into the presentation. So that should be 160. Eligible activities are the preventive screenings, social and educational, exercise and fitness. All the things we should be doing and really should be fun. So it's a great time to get rewarded for that. Here's some of the cards that you can redeem for. So it's a little bit of everything. We've got lots of restaurants. We've got some Lowe's, PetSmart, Starbucks, TJ Maxx, Subway, grocery stores, Shell gas stations, BP, little bit of everything. In Humana neighborhood centers, we do not have any brick and mortar locations, so no actual physical locations in Colorado. But what's really cool is they have virtual centers accessible from all 50 states and Puerto Rico. They will include health and wellness programs and services, classes on different topics, activities that you can join in. You can learn about educational aspects. You can learn how to tie flies. Whatever it is that you're interested in, you can go on to the Humana Neighborhood Center, look at the listing of classes that's out there, and you can join virtually. They also have customer care specialists that are available for chat if you have a quick question about your plan, and health educators. So if you have received a diagnosis about something and you're looking for maybe changing your diet to accommodate that, the health educators are there for you to ask those questions of. CenterWell Pharmacy. So the biggest phone caller of all time, they love their pharmacy. And really, there are very good aspects of the pharmacy. You can save quite a bit of money on many medications, not all of them, but many you really can. It can be a really beneficial thing. The other thing to keep in mind is that you can always talk to a pharmacist. So they have hours here, regardless if you're filling your prescriptions through CenterWell or not, you have a live chat service during business hours. Additionally, they have 24/7 pharmacists available. So if it's 2 o'clock in the morning and you feel like there's something wrong with a medication that you've taken, you can call CenterWell. So our local Safeway is not open at 2 a.m. for us to call if something is going wrong. So this is an important feature to know about. Mail delivery, their mail delivery is discreet and you have real-time tracking capabilities so you can watch it travel across the country. Two pharmacists also review the medication for safety. That's unusual. Most of the time we have one pharmacist who oversees a farm tech that's doing it. So that is a really important thing to know that they're really working at accuracy. You can order in multiple ways and you can auto refill certain things that you get all the time. So there's lots of different things out there for it. Some people love mail order pharmacy and others do not. It is a choice for you. It is not mandatory. So there's a majority of tier 1 and tier 2 drugs have no accumulation towards the coverage gap. So if you have expensive medications, it is important to try to use CenterWell for those really inexpensive ones because they're not then getting you to the gap coverage sooner. The other thing that I really like to say about this is if you have something extraordinarily expensive that has been prescribed to you and you're looking at $1,000 payment as your cost share, you can require or request payment plans for it. So that way you're not having to pay that large lump sum of money. You can spread it out over time and there is no finance charge on it. So they're working to be able to get you to be able to afford that medication. And for those of you who don't know, our fourth phase of drug coverage now, there is no more cost share. It used to be 5% of the medication cost, and that has gone down to 0. So just to get to that catastrophic coverage, your cost share can still be in the thousands. And being able to have that payment plan rather than having to pay it in one lump sum in January is a really big plus there. So getting started with CenterWell, if you have not been already signed up through all the phone calls you received, here's their phone number. You can visit the pharmacy. That's also how you order over-the-counter items. And you can use your My Humana app. So all of those ways will get you started with it. Transport services, our Humana HMO Gold Plus plan does have rides to and from the doctor that are included on the plan. So you want to call Humana's customer care. You're going to have your Humana ID card right there. Tell them when you need your ride, basically. What is your appointment date and time, and where you want to be picked up, and what time you want to be picked up. Some people like to arrive at the doctor's office quite a bit before their actual appointment. It can be difficult to get in. They want to be able to rest and be ready for that appointment before it starts. So remember, their customer care number is open 8 until 8, and you can request those rides to any of your doctor services. All right, so this is how you find the house calls. So when we are on the Find a Provider and we are looking for medical results in this case, there is this show results for, and you will see house call on there. So it will search for all those physicians who want to do house calls. Okay, payments. We typically set you up on a payment plan. Most of our clients are on zero premium plans. A good amount, though, are on a premium paying plan now. So you can do automatic payments either through your bank account, Social Security, or Railroad Retirement, or you can digitally pay through My Humana or Express Bill Pay. So there's lots of different ways to do that. Keep in mind if you've chosen Social Security, the insurance companies usually like you to stay with that through the end of the year. So it's more of an annual change. It's difficult for them to change that mid-year. Caregiver resources. And we're going to call it quits here. Caregiver resources is something that is extremely dear to my heart. I've been a caregiver several times in my life, and I know how much it takes to do it, and that you have very little time for yourself. So, caregiving, this toolkit that's available on humana.com gives you checklists, things to help you organize. It gives you a PHI form to where you can talk to Humana about your loved one's policy with their consent. They give you home and community support. So they find resources within the community that will help you. Do you need a wheelchair ramp into your house, but maybe you can't afford to build it? Also, professional organizations. We have a wonderful one locally called Dementia Together, and they help people who are trying to take care of their loved ones in their home who are starting to show signs of dementia. So you can find quick links to those organizations that are near you. And then last but not least, how do you squeeze some self-care in when you are a caregiver? That's probably the most difficult aspect of it all. And they give you lots of great small tips, just little things to do for yourself to keep you going. So I want to tie this up now and open up for a few minutes of questions. Basically, we are here for you. Amy and I have our email addresses out here. Although I would recommend using our regular TIA address, because if we're in appointments all day and or gone from the office, then it's going to take a while for us to respond to you. This one will get routed to a person who can answer your question sooner. But if it's not a hurry, you are welcome to email myself or Amy, and we will get back to you. We sometimes it takes us a little bit to get the answers that you're looking for, but we're happy to dig in and look at it. All right, guys, I'm going to stop the recording now, and then we will get started with some questions.